Vape pens, dabs, and shatter routinely hit 80 to 90% THC. Two substances can be harmful at the same time. Cannabis technically reduces nausea in medical patients. And you notice cold fingers or toes, the most concerning physiology is happening. When THC levels spike rapidly, people assume they're lazy or burned out. Fixing circadian rhythm disruption. There's a biological misconception that's been circulating for decades, and it's this idea that because cannabis is natural, it must also be harmless. But natural tells you nothing about biological impact. Hemlock is natural, wildfire smoke is natural, cyanide is natural. The human body responds to chemistry, not ideology. I'm Dr. Amin Hedayat, Assistant Clinical Professor and Neuroscience-trained triple board certified pathologist and dermatopathologist. My world is the microscope. I diagnose disease by reading the truth written inside your cells. And one thing I've learned after thousands of tissue evaluations is this: people can lie, cells cannot. When I examine the skin, the collagen, the arteries, and the neurons of heavy cannabis users in 2025, I don't see a harmless plant. I see inflammation. I see cellular stress. I see premature aging. And I see neural pruning, a mechanism confirmed in a late 2024 study published in the Journal of Neuroscience, which documented structural thinning and dendritic loss in high THC users, especially in younger adults. Today, we're going deep into the biology. No politics, no moralizing, just cellular truth. We're covering combustion toxins, collagen-eating enzymes, gut-brain receptor overload, vascular inflammation, neural pruning, and finally, how to reverse inflammation and support healing. And I'll give you some protocols for the healing process. And before we continue, an important reminder: if you use cannabis medically for chemotherapy, nausea, seizure disorders, or cancer pain under physician's supervision, do not change your regimen. Your risk-benefit ratio is very different. In this video, I'm talking today specifically to the healthy, recreational, high-potency users who believe the risk is zero. If you appreciate science explained through real pathology and real mechanisms, please hit like. It helps this video reach the people who have never seen what inflammation truly looks like under the microscope. Okay, let's begin. To understand the biological impact, we must first understand the substance. The cannabis of today is nothing like the cannabis of the 1970s or even the 1990s. According to long-running potency data collected by the National Institute on Drug Abuse and the University of Mississippi's Potency Monitoring Program, average THC concentrations in the 1990s were about 3 to 4%. And those plants contain not only THC, but also CBD, CBN, and a full terpene profile. It was a complex plant. But today, dispensary flower averages 18 to 25% THC. Vape pens, dabs, and shatter routinely hit 80 to 90% THC. Some distillates even approach 95%. That's not the same compound. It behaves differently, neurologically, metabolically, and immunologically. This is where the concept of the therapeutic window matters. Every drug has a zone where it's therapeutic and a zone where it becomes toxic. By stripping out CBD, which is naturally anti-inflammatory, and amplifying THC, we've taken the plant that once had balance and turn it into a chemical isolate. This is why the brain reacts differently, why the gut reacts differently, why the vascular system reacts differently, and why the collagen matrix, the scaffolding of your skin, react dramatically different. People often say, well, alcohol is dangerous too. That's true. Alcohol is classified as a Group 1 carcinogen by the International Agency for Research on Cancer. But pointing at alcohol doesn't make cannabis harmless. Two substances can be harmful at the same time. Your cells do not respond to cultural narratives. They respond to molecules. If this is clarifying things for you, please tap like. It tells the algorithm that scientific clarity matters. Let's start with something visible, your skin. Picture your skin like a suspension bridge. Collagen is the thick steel cable that gives it strength. Elastin is the flexible cord that gives it bounce. That structure is what makes skin youthful, firm, and lifted. Now here's what happens when you burn cannabis. Combustion, which is lighting plant matter on fire, produces polycyclic aromatic hydrocarbons, or PAHs. These are the same toxins found in cigarette smoke, wildfire smoke, and car exhaust. Multiple dermatology journals, including JAMA Dermatology and the British Journal of Dermatology, have documented how PAHs affect the skin's structural proteins. Your skin contains a pollution sensor. It's called aryl hydrocarbon receptors, or the AHR. The moment PAHs enter your bloodstream, they bind to AHR. AHR then activates a gene pathway that tells the cell to produce an enzyme called MMP1, which stands for matrix metalloproteinase 1. Think of MMP1 as little molecular Pac-Man enzymes. In tiny amounts, they help remodel tissue. In large amounts, they chew through collagen. Under the microscope, I see collagen that should look like thick rope-like cables reduced to broken, frayed segments. I see elastin fibers clumping and collapsing, a process known as solar elastosis. This is normally seen in people in their 60s, 70s, 80s after decades of sun damage. We used to see this mostly in farmers, but I'm now seeing it in heavy cannabis smokers in their 20s, 30s, and no cream reverses this. No serum stops the enzyme. No supplement rebuilds collagen while you continue adding PAH exposure upstream. This is the biological cost of combustion. Now let's move deeper inside. There's a condition exploding in emergency medicine called cannabinoid hyperemesis syndrome, or CHS. Multiple clinical reviews, including those in Mayo Clinic proceedings, describe this paradox. Cannabis technically reduces nausea in medical patients, yet it can cause severe nausea in heavy recreational users. The reason is receptor overload. Your gut has its own endocannabinoid system. When exposed repeatedly to high-potency THC, those receptors flip from soothing to overstimulated. The result is waves of nausea, vomiting, and abdominal pain. And here's the strange part. Patients discover that scalding hot water temporarily stops the nausea. Why? Because hot water activates TRPV1, which is a pain heat receptor on the skin. The same receptors that are activated by chili peppers. This sensory overload momentarily distracts the gut-brain axis. but the consequences can be serious. I've seen patients taking 3, 4, even 5 scorching hot showers a day. Others fall asleep on heating pads set to maximum heat. And this leads to a condition called erythema ab igni, redness from fire. Dermatology literature describes a net-like lace pattern caused by chronic heat exposure. Under the microscope, I see heat-damaged skin cells, ruptured capillaries, red blood cell leakage into tissue, iron staining, chronic inflammation. This isn't a rash. It's structural thermal injury. Now we go to the vascular system, the system people ignore until it's too late. There's a rare but devastating condition documented in vascular literature called cannabis arteritis. It closely resembles Buerger's disease, a severe inflammatory condition seen in heavy tobacco smokers. One of the most harrowing cases was published in the Journal of Vascular Surgery. A 26-year-old man, athletic, no diabetes, no cholesterol problems, and yet developed progressive arterial narrowing in his legs. Here's how it unfolded. First, his foot felt cold, then painful. Then his big toe turned pale, then purple, then black. Gangrene. His arteries were inflamed from the inside. Imagine a garden hose. Now imagine the inner lining swelling until the flow of water narrows. Then it stops completely. No blood means no oxygen. No oxygen means tissue death. If you're a heavy user and you notice cold fingers or toes, color changes, or pain when walking, these are not poor circulation. These are warning signs that warrant immediate medical evaluation. While rare, this condition shows exactly how inflammation can overwhelm genetic weak points. Now we move to the brain, the place where the most concerning physiology is happening. There's a persistent myth that cannabis doesn't kill brain cells. And while that's mostly true, it's also deeply misleading. The issue is not cell death. The issue is connectivity, the architecture of your neurons. A healthy neuron looks like a massive oak tree. It has a trunk called the axon and thousands of branches called the dendrites. These branches are where learning, memory, motivation, and executive function live. A study published in late 2024 in the Journal of Neuroscience looked at adolescents exposed to high-potency THC. The researchers found several major changes in the brain. They showed cortical thinning. Basically, the outer layer of the brain, the part responsible for thinking, focus, planning, and memory, became slightly thinner, which can reduce mental sharpness. They also showed reduced dendritic spine density, the tiny connectors that help brain cells talk to each other, became fewer in number. Fewer connectors mean slower thinking and weaker memory. They showed hyperactivation of microglia. Essentially, the brain's immune cells become overactive. They start cleaning up too aggressively, even trimming away healthy connections. They showed loss of structural complexity. Brain cells look less full, less branched, and less connected, almost like a tree losing many of its branches. They showed altered prefrontal cortex connectivity, the wiring in the part of the brain responsible for planning, motivation, decision, and self-control became less efficient. That can show up as brain fog, lower motivation, or difficulty staying organized. Microglia are the gardeners of the brain. They prune dead connections to keep the neural network healthy. But with repeated exposure to high-potency THC, microglia become overactive. They start pruning healthy branches. So the neuron doesn't die, but the canopy disappears. This correlates with the symptoms people describe: brain fog, slow thinking, decreased motivation, emotional flatness, difficulty learning new skills, loss of drive and initiative. You didn't lose the neurons. You lost the branches that made you feel sharp, motivated, and mentally alive. If you know someone who's been struggling with these issues, you're welcome to share this with them. A little knowledge can be a powerful gift. And the good news is that there are ways to regrow these branches. Brain-derived neurotrophic factor, or BDNF. It plays a key role, and we'll talk about that very soon in this video. Now that we've looked at neural pruning, let's go deeper into neuroimmune mechanism that drives it. When THC levels spike rapidly, especially with concentrates, dabs, and high-potency vape oils, the endocannabinoid system becomes overwhelmed. The body's own cannabinoid receptors weren't built for industrial-strength THC. Neuroscience research over the past decade, including work published in Nature Reviews, Neuroscience, and Journal of Neuroinflammation, shows that the brain's immune cells respond directly to this overload. Specifically, microglia shift from maintenance mode into reactive mode. In reactive mode, microglia release inflammatory cytokines. These cytokines then stimulate pruning pathways. The pruning pathways then accelerate dendritic loss, and the loss of dendrites directly reduces prefrontal cortex efficiency, the part of the brain responsible for planning, impulse control, motivation, and higher reasoning. This is why people often report, "I don't feel sharp," or "I forget small things," or "I feel disconnected," or "I'm not as driven as before." This isn't psychological, it's structural, and it's reversible if you respect the biology. If someone you love needs this, don't hesitate to send it their way. Now let's talk about a mechanism most people have never heard of: the burnout loop of the endocannabinoid system. Your brain naturally produces cannabinoids, anandamides, and 2-AG. These regulate mood, pain, motivation, appetite, and stress resilience. Research from Cell Reports and PNAS shows that when external THC floods the receptors repeatedly, your body downregulates its own production. In simple terms, your brain stops making its natural cannabinoids because the system is overloaded. This leads to lower baseline motivation, higher baseline stress, reduced pleasure from normal activities, slower cognitive bandwidth, and increased dependence on external stimulation. This is what clinicians are now calling cannabis-associated dopaminergic flattening, something being increasingly documented in neuropsychiatric literature. When motivation drops, people assume they're lazy or burned out. In reality, they're biochemically depleted. This is why chronic users often say, "I don't feel myself unless I'm high." That's not preference. That's receptor exhaustion. We're going to talk soon about how to reset those receptors properly. Now, let's shift from the brain to the hormones. Your circadian rhythm, your internal clock, is tightly regulated by cortisol, melatonin, light exposure, and sleep architecture. High-potency THC disrupts this rhythm in several documented ways. A 2020 study in Sleep Medicine Reviews demonstrated that THC reduces REM sleep, distorts sleep cycles, and alters next-day cortisol patterns. Another study from the Journal of Clinical Endocrinology and Metabolism showed irregular cortisol curves in chronic heavy users. What does this mean practically? It means you wake up less restored. Your morning cortisol peak becomes blunted. Your energy feels inconsistent. Your focus becomes unstable. Your stress tolerance drops. Your emotional resilience drops. And your metabolic rhythm shifts. This hormonal disruption plays directly into inflammation, especially inflammatory cytokines like IL-6 and TNF-alpha, which increase in dysregulated circadian states. This is why many chronic users describe feeling tired, foggy, or low energy, even when they sleep 7 to 8 hours. The architecture of the sleep was damaged. We'll address how to reverse this next. Inflammation is not a one-way street. Cells regenerate. Dendrites regrow. Collagen can be rebuilt. The vascular system can repair. Neurotransmitter systems can normalize. But only if you stop overwhelming the system. Here's my Get Uninflamed protocol, the anti-inflammatory reset based directly on evidence from journals like Nature Metabolism, Cell, JAMA Dermatology, and Neuroscience and Behavioral Reviews. Protocol number 1, stop combustion completely. This is non-negotiable. Every study on PAHs, from dermatology to pulmonology, shows the same thing. Combustion is the upstream trigger for the collagen-eating enzyme MMP1. If you remove combustion, you remove 80 to 90% of inflammatory load. This alone gives your skin, collagen, vasculature a chance to repair. Now let's move to protocol number 2. Reset the endocannabinoid system. Heavy users need a neurochemical reset. This is supported by multiple neuroimaging studies in neuropsychopharmacology and addiction biology. What does a reset look like? 14 to 30 days of no THC. Hydration consistency in the first 72 hours. Morning sunlight to reset cortisol rhythms. And if your personal doctor clears you, magnesium glycinate in the evenings. High omega-3 intake. This helps restore receptor sensitivity and endogenous cannabinoid production. Protocol number 3, regrow the brain's branches. Brain-derived neurotrophic factor is essentially fertilizer for your dendrites. It grows new branches. It strengthens synaptic connections. And it reverses some of the pruning we discussed earlier. Again, if your personal physician clears you, you can increase BDNF naturally through high-intensity interval training, which is essentially zone 4 to 5 effort. It's shown repeatedly in Frontiers in Neuroscience and PNAS. Intermittent fasting, recommended 12 to 16 hours. Omega-3, DHA, and EPA. And do cognitive challenges like learning, problem solving. And lastly, cold exposure. These activities push microglia out of reactive mode and back into supportive mode. Protocol number 4, repair collagen and vascular health. Once PAH exposure stops, the collagen matrix begins slow repair. Studies in the Journal of Investigative Dermatology show that MMP1 levels drop dramatically once pollutants are removed. You support this by prioritizing protein intake, adding vitamin C from whole foods like citrus, berries, peppers, and using retinoids or peptides if approved by your dermatologist. Infrared saunas without chronic heat exposure. Avoiding seed oils and ultra-processed foods. This creates an environment where collagen can rebuild without constant enzymatic attack. And for protocol number 5, rebuild hormonal rhythm. Fixing circadian rhythm disruption is one of the fastest ways to calm inflammation. Let's talk about what works to rebuild your hormonal rhythm. Waking up at the same time daily, getting 5 to 10 minutes of morning sunlight, no caffeine after 2 p.m., magnesium glycinate at night, a consistent 2-hour sleep window, limiting screens for 30 to 60 minutes before bed. These steps regulate cortisol, restore REM architecture, and reduce inflammatory cytokines overnight. When you begin reversing inflammation, there's often a detox window. Research published in Psychiatry Research and Addiction Biology shows that during cannabinoid receptor reset, people may experience irritability, sleep disruption, changes in appetite, temporary mood dips, temporary anxiety, temperature sensitivity. This lasts anywhere from 3 to 10 days for most people. Afterwards, the benefits typically begin. Sharper thinking, cleaner memory, better sleep, increased motivation, healthier skin tone, improved vascular responsiveness, more stable energy, easier emotional regulation. Your brain wants to return to homeostasis. Your skin wants to heal. Your collagen wants to rebuild. Your vascular system wants to relax. Your neurons want to reconnect. You just have to stop setting the construction site on fire. Here's the truth. Your body is a miracle of engineering. It adapts, it repairs, it regenerates, it wants coherence. When you remove inflammatory triggers and give your biology what it needs, like rhythm, nutrition, sunlight, movement, sleep, stillness, you shift out of survival mode and back into clarity. If you use cannabis medically under supervision, please stay with your physician. This is not about you. But if you're a recreational high-potency user who didn't know the biological cost, now you do. And you now know how to reverse the damage. If this brought you value, please share it with someone close to you. That's how we build a healthier and more informed community. I'm Dr. Amin, and my job is to show you what your cells are telling you with clarity, honesty, and evidence.